Thank you everyone for your patience and our technical difficulties. Please let us know in the question and answer bar that you can hear us now and see the first screen on the slide.
Great.
Perfect. Well, we will go ahead and get started again. We appreciate your patience and getting this webinar started on the graduate certificate in global health practice. I'm Kelly Curtis. I'm one of the admissions officers here in the department for this program. I would like to introduce Dr. Bill Brieger. He is the program director. Bill, would you like to share a little bit about your background?
Okay. Well, I've been teaching at Hopkins for quite a number of years and mainly online. So that's why it was easy to adapt this certificate program to what I've been doing. I started teaching online at Hopkins in 1996, sorry, yeah, because I was actually working at the University of Ibadan in Nigeria from 1976 to 2002. I would come back to Hopkins in the summer to do some teaching, and I started teaching my courses online during that summer session in 1996. And so when I came back from Nigeria in 2002 and started working full-time at Hopkins, I continued working with the online program. And so everything I do, whether it's for MPH, MAS, OPAL certificates, all of my courses are online. I've been focusing on community-based primary health care, social and behavior change activities, tropical disease control, both in Nigeria and then since I'm back here, been working in particular on malaria and other infectious diseases. So give you some ideas. My courses cover a lot of these experiences. So when you join the program and the courses, you'll learn more about this.
So today's agenda will include an industry overview. Both program and curriculum details will be covered. Faculty will be presented. And we'll share what online learning is like here at Johns Hopkins with over 20 years of online experience, as well as the level of support that we will provide throughout the admissions process and throughout the program. I'll cover admission requirements and financial aid. And as I think most of you have found, the Q&A tab that you can open up. And as you have questions throughout this program, feel free to put those questions in there. And then we'll address those at the end of the presentation.
Okay, if you want to make me a co-host, I'll be able to advance the slides more easily. If not, I'll just tell you when it's time. But we want to...
Yeah, go ahead and let me know when.
Yeah, okay. Our Department of International Health at the School of Public Health was the first such designated department. We're over 50 years old. And at that time, international health covered what we were doing. New terminology, global health, has been applied recently, but it's really a false distinction because what we're concerned about is looking at health systems, health problems throughout the world in different settings with particular attention to how health systems work, with a particular concern about disadvantaged groups of people in many countries. So again, looking at these types of population is a concern throughout the world. We're concerned about equity. We involve multidisciplinary approaches. We have faculty with all kinds of backgrounds. My background is more in social science. We have people in laboratory sciences, medical, and nursing, so that we bring all of these people together with a team approach to address the health needs of populations. So we're concerned at international and global levels. We're also concerned how these care are carried out at local levels, county, district, how healthcare reaches people, at the local level, and people, as we often say in the River Blindness Control Program, beyond the end of the road. Many of our programs are built on the Alma-Ata Declaration. This was 1978. This was where the concept of primary health care at the community level was best and first articulated. WHO and UNICEF brought people together, and the result was a declaration of health for all, trying to make sure that adequate health care was universally available to all populations. And again, overcoming inequities, overcoming barriers to services within countries, between countries. Okay. Next. So again, as I said, we're the oldest department with this type of designation, founded in 1961. And we do seek to understand, as we said, the major health problems in the world, develop affordable means of disease reduction and health protection for the underserved populations throughout the world. And the reason we say throughout the world, we do have people in our department who are concerned with migrant populations coming into the US. We're concerned about the Native American populations within the US because, again, they represent an important social and cultural group. So we look broadly across the world to identify people in need and understand the systems that serve them, the strengths and weaknesses of those. So we do this by conducting research, educating scientists and professionals like yourselves, guide policy, guide and provide consultation for public health practice in many settings, and are particularly concerned about the institutional capacity of health systems at national and local levels throughout the world so that, again, we can improve health for all, as we said, with primary health care. So these are some of the links to our department, but basically if you get to jhsph.edu, you will find all of these different components. In addition, of course, you've probably looked there to find out about our certificates and other programs. So hopefully you can follow through with this and get more information. Okay. So we have two main audiences for global health programs. And again, we have run a certificate program prior to the OPAL. We found it was, for over 10 years, we've been offering a certificate to people who are not necessarily looking for another degree, but are wanting to add on in a earlier mid-career capacity, the skills, the training in global health. They may be looking for a career change or maybe strengthening the career they're already in. So this, again, provides advanced training. So as we said, also people who are already working in international health and development and want to have some of the academic experience to bolster their practical experience. So again, people who are looking for advanced training early and mid-career, and people who are already in the field of international health and development and want the certificate to validate their work. Okay. So again, our online programs are geared toward reaching audiences who would not necessarily be able to come into Baltimore and spend time. So we have quite a number of online options, and this certificate is one of those. And so we have people who have come from or may be going to development agencies. It might be USAID, it may be Peace Corps, it may be the British Department for International Development. We have people who are working in government and non-governmental organizations in low and middle income countries. That's, again, one of the benefits of running an online program, is that people can take advantage of these programs without having to get a visa to travel to the US. And that's been particularly important during the recent COVID epidemics, that people can still take advantage of online education without having to travel. And again, working professionals taking courses are able to apply what they are learning directly into their work setting, and again, take lessons from their work setting to bring them into the courses. So there's a lot of interaction among work and learning, in our online programs. So again, there are various kinds of global agencies where our students have come from or go to, such as we mentioned, WHO, UNICEF, etc. Okay. The department is quite varied. We have several research centers within the department and institutes, but the department itself is actually divided into 4 broad programs. We have a program in social and behavioral interventions. We have a program on health systems. I'm involved in both the social and behavioral interventions and the health systems program. We have global disease control, and we have human nutrition. So those are the 4 main administrative divisions and academic divisions within the department. But then we have specialized groups who are interested in American Indian health, humanitarian health, immunization, injuries, their prevention and control. As we said, immunizations and vaccines. So this is something that our faculty are actively involved in, and through our courses, people can be exposed to the workings of these organizations. And again, each of those do have something on the website. So if you're interested in these areas, please look it up. Okay. Okay, we have worked in many countries throughout the world. And as we said, we're not just limited to low and middle income countries. We've worked underserved populations in the Northern Hemisphere too, as you can see. So, and the number of projects and research awards vary from year to year. Things have been a bit slower during COVID, but again, we have global reach. Okay. So our programs generally equip students with the skills to look for, involve local people, local agencies in finding sustainable solutions to the health issues and health needs in their particular country, in their particular location, and on a regional and global basis. Our particular certificate, again, which hopefully will strengthen early and mid-career level professionals who want to work in global health, requires 20 term credits. We have 4 terms during the year. Those are 8-week terms. And so 1 or 2 courses are offered, each term, to come to a total of 20 by, the end of your program. In theory, you can complete this in 1 academic year, although because people are part-time, they sometimes spread it out over 2 years. We focus on skills for working professionals. And as we've mentioned, and I'm sure as you've seen on the website, it is part-time, it is completely online. So an average people would maybe take 4 to 6 credits during a term. Because again, everyone is usually working and has family responsibilities. So we try to be contemporary with group learning, peer assessment, and have various projects and hands-on learning as part of the assignments for our courses. One of the examples in the course I teach, students learn to write blogs so they can advocate for health issues. So we, in another course, design training program for community health workers. So we do try to have this practical focus. Okay. So again, we mentioned that we have 4 terms during the year. And so the credits are spread out. Everyone coming into Hopkins takes a non-credit course, but it's required academic and research ethics. There's also a course that everyone takes who wants to do online learning. It's called Introduction for Online Learning, and that comes up about every month or so that you can take that anytime prior to enrollment. You don't even have to be enrolled as a Hopkins student yet to take the Introduction to Online Learning. So we usually encourage people during the application process to get a head start on that, because that is the course that walks you through exactly how our online courses are run. We are very fortunate that we have a special department called the Center for Teaching and Learning that develops our own type of technical system for offering online learning. So it's unique to Hopkins and very thorough and professional. Then in terms of the main courses offered first term, we have the introductory course, Fundamentals of Global Health Practice, and people can choose between 2 other courses, either the Seminars in Public Health or Essential Medicine's Primary Healthcare. During the second term, we have a course on designing and planning primary healthcare projects. The third term, we have the global epidemiology, policies and programs, and then a choice between a course on training community health workers or a school-wide course on introduction to epidemiology. And then finally, in the fourth term, there is a course, the social and cultural basis of community and primary healthcare programs. So with these four terms and these courses, you will get your 20 credits, and in theory, you can complete in a year, depending on the time you have available. But we have it available. You can take it over 2 years. Technically, you can take it over 3 years if necessary. Sometimes life intervenes and you may have to do that. But we've designed it for people who want to finish as soon as possible. Okay. So we have the largest department in the school. In fact, some people say our department is bigger than some schools of public health. So you can see just a few people who happened to be present at a gathering just before COVID happened. But we, out of the 194 full-time faculty, and this changes month to month, but we have people in the professorial track, which is assistant, associate, and full professor. We have people who are designated as scientists who focus mainly on research projects. The professorial track does teaching, research, and service. And we have a variety of people who are working as research associates on a number of projects. But we involve people from around the world as associate or adjunct appointed faculty. We have a diverse faculty. Over 2/3 are female, near 40% are minority. And again, we have a lot of support staff because with the various projects and teaching we do, we need these people who can help us get through all of the work we have to do. Okay. The main people involved in this program, myself as the program director, and like I said, and Christine Salazar, together we developed an earlier version of a certificate that we offered online. It was more expensive than the Opal version. And when Opal came along, we decided to adapt our certificate to the Opal program to make it more accessible and affordable to students. In addition, we have other people such as Anna and Alan who are involved in the global epidemiology course, and Gilbert and Ambrasi who do the project development for primary healthcare courses. So we, draw in a number of, and they have a number of, all of us have a number of guest speakers that bring in other faculty members. Okay. So as was mentioned, we have over 20 years experience in online learning. In fact, as I was talking earlier, I started my first online course in 1996. The Hopkins got involved via a request by CDC to provide a type of certificate training for its employees. And that's where our online, the encouragement for online learning started. And we've now you can get, several of the full-time degrees can be gotten completely online. The courses have our Center for Teaching and Learning that I mentioned. They guarantee high production value in terms of recording, in terms of the broadcasting of lectures. So the online learning activities are designed to keep you engaged. One of the challenges with online learning is that you develop your own pace, but at the same time, you do have opportunity to interact with each other, with faculty, through various kinds of things such as live talks and discussion forums. So again, the lectures are both recorded that give you flexibility of when you want to listen, but we do have, depending on the course, we have anywhere between 3 and 5 live talks where we're all together. It's almost like sort of a radio program. And if you have difficulties, you can call on the CTL help desk 24/7. And again, when you take this Introduction to Online Learning course, you could even take it now, like I said, because you don't have to even be a currently enrolled Hopkins student. You just have to be somebody who intends to become enrolled eventually. And they explain all these things about how to get help. Okay. The courses use a variety of assessment mechanisms. We have short quizzes. These quizzes are automated online, so they're multiple choice. You get immediate feedback. We have discussion forum activities where people make postings and comment on each other's postings, so we learn from each other. We have a variety of worksheets so that you can plan activities that are of interest to you in your own work setting. Participation in live talks, of course, is a way of finding out if people are up to date, if they have any challenges, some short essays, and problem-solving exercises. But again, we do try to stress that you draw on some of your actual work experience to address the different assignments. I've mentioned the help desk because occasionally people have access problems depending on what browser you're using a particular day. You may be in a quiz and something knocks you out of the quiz. You may have challenges accessing certain lectures. So whenever there are problems, this help desk is available for you. Of course, each course, the individual faculty and their teaching assistants are available by email for support at any time. And then we have a variety of student services at the school. There's a student services coordinator. There are mental health and emotional health assistants from certified counselors. All of this is available, accessible on the website. So it's important to look at the aspect of the student services aspect of the the website. Okay. All of our applications for any degree at the school are processed through Sophus. We use Sophus Express for the certificate. We require that you have a bachelor's degree in a related field, health development related field, from an accredited university or college. We request a minimum of 2 years after that bachelor's degree in health-related or development-related work experience, ideally focusing on low and middle income countries or underserved or disadvantaged populations. You'll submit your current CV. I think for the certificate, you may only be required 1 letter of recommendation, but Sophus again will tell you what they want. It's important that you have a statement of purpose. Why do you want to take the certificate? How is it going to help with your career? What are you bringing to the program that would, have motivated you to get into global health? And then if you are coming from a country where English is not the primary language of instruction, there are English proficiency tests, TOEFL and IELTS, and there are a couple new ones, again, that would be mentioned in Sophus. And then your academic records, if it's from another country, need to be evaluated by a group called WES. I think there is one other group that is acceptable, but basically, everybody needs to submit a transcript through the normal processes. But if you come from a university outside the US that's not an accredited US university or college, it must be evaluated.
And Bill, you're right. For the graduate certificate, just 1 recommendation letter is required in the Sophus Express portal. And WES is the preferred credentialing evaluating company. There is others, if you've already had your transcripts evaluated course by course, that's on the approved list.
It's important when you do, get letters of recommendation for anything, not just our program, that you think very strategically and carefully about who you're asking to recommend you. Is this a person who can speak that you have talked to, that you have explained why you want to go for further studies, that person can then tell us in their own words why they think you are appropriate for our program, why they think you are capable of doing advanced studies, why they think this program would help your career. So be very strategic in selecting your referees.
Yeah, thanks for clarifying what the department's looking for with that recommendation letter. I can cover the next
great.
slides, give you a little bit of a break, Bill. Once your file is verified complete in Sophus Express, it does go over to the mission committee and they do ongoing acceptance decisions. The final deadline to start August 29th, 2022 is July 1st, but we do encourage applicants to apply early. And our admissions team is here to assist with the application steps. We do have support emails beyond the instructions that are in Sophus Express. So we are here to help you put together a strong file and also to do the application steps efficiently. So currently the tuition cost is $1,233 per credit hour. There is a OPAL scholarship that all students who are accepted in the program receive. So there's no separate steps that one needs to do to receive this partial OPAL scholarship. It is automatic. And as you can see, that is $474 per credit hour. Once that gets applied, the student's cost is now $759 per credit hour. And with 20 credits in this program, your investment currently would be $15,180. You pay for those credits or courses as you take them in each 8-week term. Beyond the partial OPAL scholarship, the financial aid office is available to assist with any questions on federal or private loans. And you can see their contact information, both phone and email, on this slide. If you haven't typed in your questions, please do so now. We'll try to address all your questions. Some questions may be better answered by reaching out to you directly. So Bill and I will look at the questions.
Okay, Sophia is interested in the time commitment. I think normally what you may have even heard as an undergraduate that if, for every hour of instruction, if necessary to put in 2, 3, 4 hours of study, homework, that type of thing. I think that there's sort of a standard thing. Now, again, sometimes you may find that the workload would not necessarily be spread out evenly over the week, and people tend to put things off until the weekends, that type of thing. But yeah, so again, this is what you would do in terms of thinking about whether you want to complete in 1 year or 2 years, what kind of time you have based on the work you're already doing and your family commitments. Again, the program is good for people, as Sophia is also asking, who currently have a global health or public health career. They may have done a degree that was general in public health but didn't have a global focus, and so they're want to move more into areas that focus on international health. And so this is a way of, without having to do an additional master's degree, you can gain that experience in international. So again, if you have done medical school, there's probably no need to do a master's degree unless you're wanting to get into academics. But if you're going into practice in the field, this would be good, as you're mentioning global surgery. So yeah, it would give you the perspectives you would need that you wouldn't have gotten in medical school for working in the global health field. Other people, any questions?
It looks like Kim has a question on how does the content equate to an MPH program?
Well, definitely a certificate is not a full MPH program. A full MPH program would be 81 credits. So the certificate is providing a specialized focus area, whereas an MPH would give you a broad public health training. In addition, you can have what we call concentrations or specializations, within your MPH, but the idea of the MPH is training people with those broad public health skills, whereas certificates and our school offers within the school and through OPAL and whatever, over 30 different kinds of certificates that have specialized areas of knowledge that one would add on to your existing academic and work experience. Let's see. Right now, the credits would not necessarily be directly transferable because of the different financial situation with MPH students paying the full rate for their credits and the OPAL people paying less. There is some challenge for transferring, the school being cautious about that. So yeah, I mean, one can certainly, if you've taken a similar course, you can test out of, for example, the social behavioral course. If you take the MPH and you can try to test out of the one that's required for the MPH program. that doesn't absolve you of the credit hours required to complete the MPH. So again, the idea is that the certificate is geared for professional development, built on what you are already having. So I think the comparability or the convertibility is not as easy as well. And again, if you want to send any of us emails, I don't know if my email appeared earlier, but if you have more specific questions, I can respond, or the admissions people can forward me any questions you have that they can't answer.
Yeah, absolutely. It looks like there are no other questions right now, but as Bill said, we are here to answer any additional questions. Detailed questions about the program. We'll let Bill answer those. If you have admission type of questions, our admissions team can answer that as well. Bill, do you have any closing comments?
Again, we encourage people to apply sooner as opposed to later. That would help you make your plans for the coming year. It would help us make our plans, of course, about how many people we're expecting to have. It would give you an opportunity to take the introduction to online learning. And again, we think that you would definitely benefit from adding this to your CV, to your career path, if you definitely want to work with underserved populations or in a global setting.
Thank you, everyone, for attending today's virtual open house and your patience and allowing us to get started. Again, we are here to answer any additional questions. If you are excited and you're ready to start your application, please do reach out to me here in the admissions office. You see my phone number and my email. We look forward to hearing from you. Hope you enjoyed the virtual open house today and have a great rest of your afternoon.
Take care. Guess we can stop recording.